So just a recap, you have fallen and you're at the hospital getting an x-ray. So this x-ray shows you have an osteochondral defect. The doctor explains an osteochondral defect is just a small area of cartilage that has been lost either from a trauma or a disease. Of course, in this case, a trauma. The doctor then goes to tell you this defect is only the size of a pinky nail. Well, you think, great, it's a small little problem, must have a simple, easy treatment. However, this is not the case. There is no adequate treatment for this disorder. So now you have a lifetime of pain and discomfort ahead of you. Each year, 10,000 Canadians do not have to imagine this. Each year, 10,000 Canadians are affected by an osteochondral defect. Osteochondral defect occurs in all of the major joints in the body, for example, the hip joint as well as the knee joint. In other words, an osteochondral defect is just a hole in the cartilage. This got me thinking, could I transplant something into this hole to fill in the osteochondral defect? I know this transplant would have to be strong enough to withstand the load of that joint, as well as adhered into the bone in that defect. So what is quite strong and what is able to reattach to bone? Fibrocartilage. Fibrocartilage is what attaches tendons and ligaments to the bone. So I created an osteochondral defect, and then using an anchor, transplanted a piece of fibrocartilage into that defect. After 7 weeks, these samples either went through materials testing or histological examination. These tests confirmed that yes, the fibrocartilage is able to withstand the load of a normal joint and that it has adhered into the bone in that defected area. In conclusion, fibrocartilage is the ideal transplant to treat osteochondral defects. In the future, I plan to market my own surgical technique and instrumentation to hospitals and surgeons. This is the first project to show a novel treatment to end the pain and suffering for thousands of people here in Canada and worldwide. Thank you for listening.
Awesome. Thanks, Braxton. Well, let's start with you, Hussein.
Yeah, interesting. So how many people have you spoke to about this and the applicability of this project?
I've only spoken to a few surgeons up at the hospital here, and they say it has a good chance for being successful in an actual patient due to these testing that I've done.
Awesome, thanks. Meredith?
Thank you.
Yeah, this is really fascinating. I'm curious, what's your hypothesis? Like, why hasn't someone come up with this before? Why aren't we doing this already?
Yeah, that's a good question. So there is different types of transplant people have been doing. Other types of transplant, including transplanting the bone and a piece of healthy cartilage into that joint. So similar from what I did. However, this transplant falls out. So this person could be, moving the knee, let's say, and then the transplant falls out, which is a big problem. That's why I looked at seeing if it could adhere into that defect, which it did. So people are trying to do different types of transplant. However, this is the first one to show a successful one.
Thanks. Question from Wendy Hurlbert. She says, very creative. Are there any risks of rejection?
Great question. There is no risk of rejection due to the fact that fibrocartilage in an actual patient will be taken from that patient. So you could take different pieces of fibrocartilage, such as from your Achilles tendons or something, and attach it into that joint. So there's no chance of rejection because it's coming from that own patient's body.
Okay. Thanks, Braxton.